As parents, we obsess over scraped knees and fevers, but are we thinking about their mental health? Today on Awkward Conversations, we're confronting the often overlooked topics of mental health and drug prevention in our youth. This is a conversation that every parent, caregiver, teacher, and friend needs to hear. It's a conversation we sometimes avoid, but in this case, silence is not just awkward, it can be downright dangerous. I'm your host, Jodie Sweeten, and we have joining us some amazing guests, including our very special guest co-host today, Dr. Krystal Lewis.
Thank you.
I'm so glad you're here. Dr. Krystal Lewis is a psychologist and researcher at the National Institute of Mental Health with a specific expertise in helping kids with stress and anxiety. You might also remember her from season 2 of Awkward Conversations. So welcome back, Dr. Krystal.
Thank you. I'm excited to be here today.
Yeah, this is going to be great. I'm really excited to have you join us for this conversation. Also joining us is Amy Morin, a psychotherapist, best-selling author, and host of the Mentally Stronger podcast. She has a series of books, including 13 Things Mentally Strong Kids Do, which has sold over 1 million copies and been translated into more than 40 languages. She's practiced therapy for over 20 years, and you may be one of 22 million people who have watched her TED Talk, The Secret of Becoming Mentally Strong. And, how cool is this? Amy lives on a sailboat in the Florida Keys. Amazing. Welcome, Amy.
Thank you so much for having me. I'm excited to be here.
Absolutely. We're really excited to have you join us here for this conversation. We've talked a lot about, obviously, mental health, substance use, how those things are intertwined, but I think understanding that, young people who struggle with mental health issues are so much more likely to, have issues with substance abuse. How is mental health linked to drug use in teens and tweens?
Yeah, certainly. Mental health, significantly impacts a lot of our youth, our children and adolescents, and oftentimes the experience of having symptoms of anxiety or depression, kids are looking for ways to relieve those symptoms.
Mm-hmm.
And so this can lead to self-medicating, using substances. And so there is a close relationship between mental health and substance use.
Right, and things like self-esteem issues, all of that self-medicating, that numbing, and with social media driving up rates of anxiety and depression, it's kind of a perfect storm to really all come together into a huge mental health crisis that our young people are going through right now, which I think we have really seen. Now, stress is something that we often don't acknowledge in young people. I think there's a lot of, you can't be stressed. You're not paying bills. You're not, worrying about a mortgage. But stress in young people is really important. It's really important to address. It's really important to acknowledge. So what are some of the things that, are stressing out our young people right now? I'd love to hear from both of you on what kind of those things are so that we as parents can keep an eye out for them.
I see kids being stressed from about everything from their grades to their friendship issues to what they're going to wear on Saturday or who they're hanging out with, what to do. And they're dealing with things that a lot of us didn't deal with, like social media. On social media, you can see who's hanging out and what you got left out of and what the cool kids are doing. And so often there's this fear of missing out or thinking that everybody else's life is better than yours, which is something a lot of adults deal with too, but kids often don't have the skills and tools and resources to know what do you do about those feelings or how do you take care of yourself when you're struggling and when you are stressed out.
Yeah, that's so important. And I think for children and adolescents, their world is social, right? And so there's a lot of social pressures that kids are experiencing that lead to stress for them. And it's important to identify those things.
Yeah, and it's really important to acknowledge and be like, I know these things are stressful. And, I think kids are so much more exposed to news and what's going on in the world today and take on some of those things and feel, I know my daughters talk about feeling really powerless sometimes about what's going on in the world and their ability to change it and how they're going to, rise to meet some of these challenges in their future. Dr. Krystal, this is your specialty, correct, is dealing with adolescence and stress and things like that. So tell us a little bit about your experience with working with young people in this regard.
Certainly. Over the years, we've seen significant increases in children expression of anxiety and stress, depression, a lot of mental health symptomatology. And I think it's important to just acknowledge with our kids that they are experiencing a lot of pressures that may come from social media, that come from their peers. There's a lot that's happening right now in the world that kids are seeing in the news that's contributing to the experience of stress. And so I think it's really important for us as adults, for parents, as therapists, to really work with kids to help them to identify what these, what their triggers are, what the stressors they're experiencing are, and really come up with plans for how do we cope with stress, right? And that's part of what I do in my practice, part of what I help parents do in terms of identifying signs and symptoms in their children.
Right. And so often, parents, we don't even know how to deal with our stress. We don't know how to deal with all of the things that are coming at us in social media and news and all of that every day. So I know I often think about it. If it's overwhelming for me, I can't imagine what it must be like for, young people today. And talking about depression and anxiety and some mental health issues and disorders, what are the ones that are most commonly linked to issues with substance abuse? I know all mental health disorders sometimes increase that desire to self-medicate and experimentation, but what are the ones that are most commonly linked with substance use that we can look out for?
Yeah, I think we see a fair amount of youth who have significant anxiety symptomatology, anxiety disorders. We see a lot of self-medicating with kids who have depression. ADHD, we know, is highly linked to substance use with that component of impulsivity. And so, like you mentioned, a lot of the mental health disorders are closely tied to substance use, but these specifically, we see a higher correlation there. It's
such a huge co-occurring issue, and you really can't separate one out from the other. They are very linked in so many regards. The statistics are that 2/3 of all youth with substance use disorders report at least one mental health disorder. These things are so intertwined and really hard to separate from each other. And that's not even other types of mental disorders that show up in like early adulthood. But, this is your area of expertise. How do we work on treating both of these things?
Yeah, that's very important. I think when kids know that something is wrong, so they're experiencing symptomatology, they might have high levels of anxiety, they might be feeling sad, they're more likely to seek ways to reduce that symptomatology, which might be through substance use. And so when working with youth, it's helpful to really identify what these mental health symptoms are to help provide them with coping strategies.
Got it. And, some of the coping strategies are talked about so wonderfully in your book, 13 Things That Mentally Strong People Do, 13 Things That Mentally Strong Kids Do. I would love to hear from you, too, what some of the signs are that you have found in your work, and also, how we can help detect these issues before they really spiral out of control.
We know that kids go through phases, so it's normal for kids to go through a different phase, or maybe they test out a new sport, or they decide, I'm going to give up that instrument I played. But when you see bigger behavior changes that last more than 2 weeks, and it might be changes in their sleep habits, changes in their appetites, they start to lose interest in multiple things, their grades might decline, they start hanging out with different kids, or maybe they don't hang out with anybody at all, and they just don't have the same interests and passions, and they might be extra moody, or they might be complaining of being extra tired. And we know that younger people, too, sometimes don't have the language to say, gee, I feel really depressed today, or gosh, I have a lot of anxiety, but instead they make a physical complaint. So it's really common for younger people to say, I have a headache and I have a stomach ache. And they might really have those things, but they might not be able to connect the dots and say, it's because I'm really stressed out or because I'm struggling lately. So to be on the lookout for those things. A lot of doctor's appointments are actually mental health related underneath those physical complaints of not feeling well.
It's so important to listen to our kids. But I also know as a parent, sometimes I'm like, can you clean your room? Oh, my stomach hurts. And those things happen all the time. And I think as a parent, it can become difficult sometimes to go, oh, am I listening? Am I sort of co-signing their excuses? What's how best to balance that? And parents, you feel like you're not ever quite sure. How do you tell parents what to pay attention to?
Right. It can be difficult to be able to differentiate between normative behaviors that kids might demonstrate and what's leading towards problematic behaviors. And so what I say when I'm working with parents and families, is we looking at the duration. So as we mentioned, how long has this behavior been going on? Looking at the intensity of it. And so is this more of a normative response, right? As we expect, like you mentioned, telling your daughter to clean her room, we're going to get the eye roll.
Right.
I don't really want to do this, right? Okay, that can be expected, right? But when it seems to be more of a dramatic response that occurs each time, so the intensity of the response, I think these are things we look at: duration, we look at in intensity, and then we look at just interference. How much is this interference in your family functioning, right? Is this something that happens once in a while, or is this a daily issue that's coming up? And so it's important to look at all of these different areas to determine kind of how much this may be a problem.
Got it. And as well as a family history, I know so many adults are dealing with issues of anxiety and depression or mental health issues, and really paying attention and knowing if those things run in our family, our kids may be more likely to struggle with those things as well. Now, things like feeling sad and withdrawn, self-harm, suicidal ideation, aggressive behavior, difficulty concentrating, intense worries, personality changes, all those things you talked about, are we're going to list those in the notes as well for parents so that they can really take a look and see if their children are dealing with any of those kinds of behaviors. And again, if that duration, intensity, interference is there, those are some signs to look for to get your kids help. But what are some signs of stress in your kids? I know that sometimes depression can present itself one way, but sometimes when our kids are anxious and stressed out, it goes kind of the other direction into some more aggressive behavior or more, easily upset or things like that can sometimes also mirror ADHD symptoms. So, it's pulling those apart can be difficult. But what are some signs of stress in kids?
Yeah, I mean, I think for some kids, we might expect them to be stressed with certain transitions, right? Maybe going into a new school or if we're moving, and certain behaviors can be expected. But for other kids, right, they may demonstrate exaggerated responses. So when we're looking at signs of stress in kids, what we want to see is, are there changes in their behavior, again, that are more lasting, not just kind of one-time thing, but have their behaviors changed? Are they verbalizing physiological complaints, right? So they're saying they have headaches. Are they having stomach aches? What are some of the signs that let us know, okay, something may be going on right now with my child? We often might see changes in the way they're performing in school. So kids' world is academics, right, is school. And so if we start to see maybe that they're not performing as well, maybe they're avoiding going to school, and so certain behaviors. So essentially, we need to identify, in certain situations, whether these are just kind of stressors that they're experiencing, right, or is this more of a mental health issue?
Right, because, anxiety versus stress is, again, can be very similar. Stress you can kind of work through, but an anxiety disorder or consistent anxiety issues are obviously a lot more problematic.
Exactly. So stress can be kind of a response to something that's happening right here in the here and now, right? There's a stressful experience that's occurring. When the anxiety, when we're looking at anxiety, it can be more so a worry about an unrealized future, worry about something that has not happened yet. So stress can be kind of like that physiological response to a situation. Anxiety, we'll say, is more of a psychological response. And so the anxiety then is impacting the child's ability to perform their kind of normative duties, right? The anxiety is persistent. The anxiety is getting in the way of the child being able to function as we would expect them to be. And so it's important to be able to look at that differentiation between stress and anxiety.
We'll be right back after this message.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
And Amy, one of the things that you mentioned was, when you take your kids to the pediatrician, oftentimes sort of the appointments can have that underlying mental health check-in that, kids may or may not be aware of if they're reporting stomach aches, headaches, things, and you take them to the doctor. What else should parents do if they suspect that their child is perhaps self-medicating with drugs and alcohol or is struggling with some mental health issues? What are some of the things that parents can do to really encourage their kids to get the help that they need?
So one thing is to have open conversations about what you're noticing. Don't make any accusations about what you think that they're doing, but instead you can say, I noticed that you have trouble getting up in the morning all of a sudden, and you never struggled with that before. Or I noticed when you get home from school, you're really tired and you take a nap. And then make sure that you are doing a good job taking notes on what you see as well. Sometimes when we try to report it to a doctor, we say, well, their mood has been off for a while. It's much more helpful if we can say that my child has struggled with sleep for the past 3 weeks and their appetite has been off for about a month. When we can give as many details as possible, that's much more helpful. And I always encourage parents to give kids a few minutes alone with the doctor if possible. Sometimes the doctor will ask questions, and if we're in the room, they're going to say, nope, that's not an issue. But if we give them some private time with the doctor, sometimes they'll open up or at least ask questions of the doctor that they might not ask if we were sitting right there. Sometimes they can say, I have a friend who struggles with something. What should my friend do? They might be more willing to at least ask those questions when we're not standing right there.
Absolutely. I've found that really key. My daughters are 15 and almost 13. And, taking them to their pediatrician appointments I know, I'm like, you guys I'll be in here for some of it to express anything that I need to. But then I definitely go, okay, now's your time with the doctor, because I know that sometimes mom's presence is going to make them not maybe share certain things. And I don't take that personally. I think it's always really important to remind parents not to take that personally. Now, talking about, substance use and its relation to mental health disorders and sort of what those co-occurring disorders are, how can parents work on treating both of those things at the same time? Because it really is a two-pronged approach. You can't treat one without treating the other.
I think it's important that parents are connected to a provider, a specialist who can work with mental health as well as substance use or abuse issues. And so having a therapist who is well-versed, I think, is important so that we can provide treatment for the underlying symptomatology that's leading into the substance use, right? Once it becomes a problem where it may be kind of an addiction issue, substance misuse, you must address that. However, looking at, what else is happening? What else is going on here? And so it might be that more than one provider needs to be involved. Mm-hmm. It might be that the child might need more intensive services. And so there are a lot of great resources out there for parents to be connected to different treatment facilities, treatment providers. As was just mentioned, going on the websites, there's the National Institute of Mental Health as well, has a lot of good information for where to go, where parents can go.
Got it. And also realizing that, mental health, it's a spectrum. Mm-hmm. It is not, there are even within a family, you may have more severe cases of anxiety in one child and then in another, and really listening and treating each child individually and respecting what they're going through it's difficult, but it's really, really important. How can parents support their child's mental health? What are some of the things that, Amy, that you've discussed in your book that help parents support their child's mental health journey and maybe help make them a better ally to their kids while they're struggling with this?
Just talking about mental health on a regular basis is so important, because we talk a lot about physical health, and nobody holds back from telling their kids about healthy food or about exercise. But it's important to talk about what's good for your mental health too, whether that might be, I don't feel like going and doing this thing today, but I'm going to push myself to do it because that's really good for me to do. Or some cases it might be, I'm going to stay home today and take a little bit of a break for my mental health. But normalizing those conversations and then talking about what can you do for your mental health. Might be small things like I practice gratitude, or I go for a walk every evening, or I spend time in nature, I shut my phone off for a little while. Just mentioning those things and then setting up practices so that kids can get involved in that as well. And you mentioned earlier, Jodie, about the spectrum of mental health, and that's for all of us every single day. And for kids to know that we're not either mentally healthy or mentally ill, it's this spectrum, and where you are at noon may be different than where you are when you go to bed, depending on whatever happened throughout the day.
Very true.
And that nobody's crazy, and that if you're struggling with something, it doesn't make you weak or anything like that, but it just means that maybe you need a little more self-care, maybe we need some new strategies to help you, or maybe it rises to the level of needing to talk to a professional, just like we would with a physical health issue. If you have a little scrape on your knee, you take care of it at home. If you have a really big cut, you might have to go to the doctor. And when we normalize those things, then kids know, oh, okay, it's not a huge deal if you have to talk to somebody about it, and it's to be expected, but there's also things we can do at home every day to manage our mental health better too.
Right. And one thing I will say, and that I've noticed that I'm really proud of in like my girls' generation and younger generations, is the honesty that they are talking about mental health. So much more, and really the destigmatization, which we've talked about on this show, and I've talked about so many times in dealing with substance use and mental health, both of which I have struggled with. But talking about it and openly and honestly really does remove some of the stigma, and there's so many resources out there. But one thing I do hear about, and I'd love to get your opinion on this too, and your input, is I know that now with the advent of social media and things like TikTok and Instagram, so much mental health information is being pushed out there. How can parents and young people differentiate between what is actual helpful information and what is, just sort of being thrown out there in order to get more likes or follows or things like that? Because there's some great things I found out there, and then I've also seen some things I go, that doesn't sound like a great way to handle that, but it's got 100,000 likes or something. So what are some ways that parents can sort of differentiate between what are good resources online and what may be not helpful to yourself or your young people?
Yeah, it's an important conversation to have. I think there's a lot of misinformation on social media. But to your but to your point, there's also a lot of great information, and that's where our youth are getting a lot of their information as it relates to mental health and life in general. And so I think for parents, for families, it's important to have open communication about mental health, about substance use, what their kids are looking at on TikTok, right? What they're looking at on Instagram, and how much of that is normative, how much of that is more of just the cultural piece, right, which is sensationalized. How do we tease apart what's accurate information versus not? I think parents should just encourage kids having open conversations with them about what they're looking at, parents approaching this with their teens as well. And I think just generally knowing that there's some information that's going to be really helpful, but where else can we get more relevant and more scientifically backed information? And so if your child does come to you saying, hey, I saw this on Instagram or on TikTok, and there's some doubt behind, like, oh, well, we don't know how accurate this is. Hey, let's look some of this up together, right? Let's get more information. So we're not just going off of what we're seeing on social media.
Right. And also, we have done an episode on this too about the ability for medications and things like that to be prescribed online, and kids being able to find that, the self-diagnosis that happens so much with social media and things like that. And you may not be wrong about the self-diagnosis, but it doesn't mean that you should be completely treating all of your own symptoms and being like, I definitely have this, and ordering medications online.
Right. And I say that a lot with my teens. There's a reason why I am a psychologist, why there are doctors out here. These are our specialties, right? So you can bring it to us. Hey, this is what I saw online. But it's important to have the conversations about, does this actually apply to you, and kind of let the professionals really guide you in the direction of maybe a medication might be needed versus not, but not self-medicating until we get that information of what's going on with you.
I hate to cut this conversation short, but that is all the time that we have. So please tune in next week. Now, drug prevention is a necessary but serious topic to talk about, and we know as parents that this can be a scary new world to navigate. So just know you're not alone, and we are here to help. We are out of time, everyone, but please join us next week for another awkward conversation.
I think one thing is to work on not taking things personally, knowing that all kids, all teens, they're going to say things to you sometimes that you're the meanest parent ever, you're the only one who doesn't understand.
Yeah.
And to just accept that's part of parenting. And sometimes that means you're being a really good parent.
I think it's important for parents to be able to have kids maybe trying a new sport, right? Making new friends, doing different activities, taking the child out of the house to engage socially with kids.
You know, I'm so grateful that, you know, like you said, there's no perfect parent, but every once in a while I hear that I'm doing something like, okay, good. So if you're hearing this out there, parents, and you do maybe one or two things that we've talked about, good job. There is no perfect parent.
Exactly.
There's just a present parent.
Make sure to check out getsmartaboutdrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.